So who here likes pancakes? Now imagine I told you you could have all the pancakes you wanted, but you had to wear thick gloves while using the cutlery. And suddenly, something simple has become awkward, frustrating, and difficult. That's actually the reality for a lot of patients with injuries in their hands and arms with reduced sensitivity and hand function. For over a century, scientists have worked to understand how does the sense of touch work in your hands? How do you go from holding something like a fork or a button to understanding what it is and how to use it? Here's what we know so far. When we touch an object, there's deformations on your skin that are converted to tiny electrical signals which get conveyed all the way to your brain, and the brain does a lot of sophisticated processing. So a lot of therapy has focused on the brain. But in reality, these patients, despite the best possible surgeries and interventions, are unable to return to work or live independently. We think a missing piece of the link is actually in the skin of your hand. The sensory innovations in the skin are a lot more complex than we give them credit for. They're not simply carrying information upstream, they're extracting details about the touched world. And if you can figure out how they're doing this, then we'll have entirely new therapeutic targets to help people with injury. What you're seeing here is skin of the finger with really intricate sensory endings and anatomical structures. I study these structures in health, aging, and injury to see how they change so that one day we can bridge this gap between treatment and recovery. And anybody who would like to test this, the gloves are here and so is the pancakes. Thank you.